how's it going?
Good, how are you?
Good. My name's Theron. I'm a student physical therapist assistant. I'll be helping you out today. Can you just confirm your first and last name for me?
Tucker Usher.
Thank you. All right. So I was looking at your chart here. I see that we're having some complications with your pneumonia. How's that been affecting you?
I just feel like it's hard to breathe, feel congested, like I can't take a deep breath or I catch my breath with a deep breath. Just mainly the congestion or I can't get anything out is my biggest issue.
Okay. Yeah, and then is that causing you any pain?
No pain, just uncomfortable.
Yeah. Okay, so on a scale of 0 to 10, you give that a 0?
Yeah, no pain.
Okay.
Yeah, 0.
All right. And so what I plan today is to do a little bit of percussion treatment and a little airway clearance. So we'll get hands-on, kind of clear up and break up some of that mucus for you, and then teach you some techniques for getting that out of there, help you breathe a little bit better. So I'll kind of go through that, but I'll be hands-on. I'll be doing a little bit of percussion, kind of light tapping on your upper back. Do I have your consent to do that today?
Yeah.
Awesome. Thank you. And then I just have a couple of questions I gotta ask you just to make sure that this is a good treatment for you and everything's safe. So just yes or no, let me know answer to these. Do you have any unstable head or neck injuries?
No.
Any recent spinal injuries or surgeries?
No.
Any cranial hemorrhaging you know of?
No.
Okay. Any large pleural effusions? Any pulmonary edema or chronic heart failure?
No.
Pulmonary embolisms? And then I see you have high blood pressure. Is that, are you taking medication?
Yeah, I think that's that.
Yeah, that's under control.
Yep.
Good. Any recent feeding or reflux?
No.
Okay. Any rib fractures? Awesome. All right. Well, then you're good to go. Sweet. So let me just, before we get started, get a oxygen level for you here. Here. We'll let that read for a second. We'll take a note of that. Cool. We're at 97, which is great. Good. I'll take that at the end as well. Okay. All right. So, got a little timer here. We're gonna go through, just drain, just like that. We're gonna focus on that left side here. So I'm gonna give you this pillow. Just kind of lean over this, and I'm gonna have you lean forward here. Lean forward, use that pillow as kind of a cushion. You can tuck that up underneath you here. And I'm gonna focus on this left side. Good. And then I'm just gonna go ahead, start this timer. We're gonna do this for 3 minutes, okay? Let me know if you have experienced any changes or you're having any problems, okay? Okay. All right, that's time. All right, sit up nice and tall for me. Good. Feeling okay?
Yeah.
Good. All right, so now we've cleared, we used the percussion, we kind of broke everything up a little bit. Now we're gonna work on kind of clearing the airway out. So we're gonna do something that's called a huff cough.
Okay.
So this is a cough without, that keeps the glottis open, which allows that mucus to kind of travel on its way up. So it's kind of a unique way of doing it, but basically you're going to cough, nice open mouth, and it's like you're saying ha, 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 but I want you to really contract your abdomen, force that air out, and you're gonna push it out. So I'll kind of demonstrate. You're basically gonna be going like this. Okay, we'll do 3 in a row, and then we'll kind of assess and see if you have any to clear up. All right, so good, go ahead, force out. Good. Do that one more time. There, that's good. Nice, we'll do one more. Nice. How does that feel?
It's good.
Okay.
Yeah.
So that's a way that you can kind of help loosen up and then clear that mucus out of the airway there. So if you're feeling that like congestion that you're talking about, having trouble breathing, go ahead and try a couple of those huff coughs.
So instead of just normal coughing.
Right. That just allows, for those airways to stay open while you're coughing. It doesn't constrict those down. So that'll give you a little bit of relief, ideally. All right. So now that we've done a couple of things, let me just go ahead and grab another oxygen level here. We'll see. Good. 97, so we stayed consistent. So we're good to go there. Is there any questions you have for me?
No, I don't think so.
All right, well, you're set. Have a great rest of your day.